We're going to go ahead and get started. I know a number of people may still be loading onto Zoom, but we are going to go ahead and start with our Friday Zoom call. My name is Tim McKee. I'm the CEO of the Olathe Chamber of Commerce, and I'd like to welcome you today. Today we have a wonderful update in regard to the health and wellness of our Olathe community. And a couple of things as we get started. First, this video will be recorded, and we will be posting this to our website sometime, I'm sure, next week. If you have a question that you would like to ask our speaker, please feel free to do so in our question and answer mode of this video Zoom, and we will provide that to our speaker as we go along. Today, we have a wonderful sponsor of this Zoom call. And that sponsor is Pulse Design Group. And with us today, we have President Dennis Burns. Dennis, please, thank you for our sponsorship today.
Good morning, Tim. Thank you very much. And good morning, everyone. Again, Dennis Burns, President of Pulse Design Group. Pulse Design is celebrating its 40th year in business this year. We are a 100% healthcare-only architecture firm, also providing interior design, medical equipment planning, and virtual design services. So Pulse, 36 people. We're based in Lenexa, Kansas, and we work primarily in the Kansas City region with a few clients that take us a few more states around the region. We have a great relationship with Olathe Health currently and working on several projects with them. Some of the completed projects we've done, finished a family physician's clinic, relocation renovation, completed in the spring of 19, and under construction now, a surgery and pharmacy addition opening this October, and then a lab analyzer replacement. Just starting construction will take a few months. So Stan Holm and your team have been great to work with, and we're really appreciative of the relationship. I also would just like to say, I think it's amazing the healthcare leadership that has taken place, not only in your system, Stan, but the healthcare leadership across the region. It was really motivating to see other healthcare systems that usually compete joining forces during this pandemic. And so hats off to you and leading the charge there at Olathe and in the region. I'd also like to take a minute to praise Tim McKee and his staff, the Chamber and EDC. Pulse Design Group has been a member for several years now. We actually have a seat on the board of the Economic Development Council. And we're members of several chambers and EDCs in the region. And I will say that Olathe is always at the top, organized, full of energy, very transparent, and providing networking resources and education that are second to none. And I think the evidence of their success is everywhere, all around Olathe, and it continues to grow. So Tim, thank you for your leadership there. Now, I'm going to introduce our guest of honor here. And his bio was 4 pages long. I've got it down to about 1. Just kidding. This is amazing. Listen here. Stan Holm, President and Chief Executive Officer. He joined Olathe Health in November of 18. He's a board-certified healthcare financial professional of Healthcare Financial Management Association, as well as a board-certified diplomat and fellow of the American College for Healthcare Executives.
Unfortunately, we may have had a little technical problem with Dennis. And so, Stan, why don't we roll right into you?
Thanks, Johnson, Miami. Lynn, did I miss out? Did I skip? I had some problems. Lynn, Franklin, and Douglas counties. Interesting numbers here. A network of more than 325 primary care and specialty physicians, nearly 2,500 associates. Olathe Health continues to grow to meet the needs of the community. Since his arrival, Stan and his team have been very busy. Some of the expansion projects include new operating suites and a pharmacy at Olathe Med, new clinics in Spring Hill and Gardner Edgerton, as well as 119th and Ridgeview in Olathe. Under Stan's leadership, Olathe Health was one of only 14 companies and the only healthcare organization recently named to Ingram's Best Companies to Work For. Not an easy feat. Congratulations. In addition, Olathe Health has earned regional and national recognition over the past year for quality of heart attack, stroke, hip replacement, spine surgery, and obstetrics. He has a long list of personal awards and achievements. Among those are Southwest Valley Chamber of Commerce Icon Award, Outstanding Healthcare Executive of the Year award for the whole state of Arizona. Health Management Associates Top Performing Executive, and serving as an honorary commander, Medical Group 56th Fighter Wing, Luke Air Force Base. Quite a list, and we're proud to sponsor. We appreciate the relationship, Stan, and I will now turn it over to you.
Thank you, Dennis. And working with you and your team has been outstanding. It really is a great relationship with you and Tim and Susie and the team at the Chamber. Obviously, great to have you today, obviously helping me present for your Friday event. It's an honor and privilege to do that for everybody. If you'd like, I have some slides that I want to go with my update for you. It kind of is, I know a lot of people are audio learners, some are visual learners, and I'm a little bit of both. So I had asked if we could do some slides with this. And it's only about 6 or 7 slides to the viewers out there today. So hopefully it only take, CEO's talk, that usually takes about an hour, but I'm going to try to get that into about 15 minutes for some questions that we can launch into. So Susie, if we can move to the next slide. Really want to start with our mission statement. I think it's very important in really every presentation I do internally. And as we look at this update on COVID, it's just more important than ever to start with our mission statement. It's our purpose. It's why we exist as an organization. And the first 3 words are very paramount to what we're going to talk about today, but in what we do every single day within Olathe Health, and it's to help people. And how do we do that? It's through healing, what we do outside our walls, caring for individuals, health, what I share with individuals, we do outside our walls, and connecting with our community. And then happiness, that's an important piece, even though we know that's a subjective word when we created this mission statement. It's only 8 words for a reason. We want all 2,500 of our associates to memorize it, to know it, to embrace it. But in happiness, we really break that down into making sure we provide fast, easy, great service for the individuals that we serve throughout our community and at our different locations. Moving on, I really want to give you an update of early days within the pandemic. I know everybody in all your businesses responded in different ways, and this is just a snapshot into one of the essential businesses for what we were responding to, knowing that we were going to be on the forefront of patients with the virus and obviously those persons under investigation. The PUI number, obviously something we tracked in our incident command. We lifted incident command. We did that across, we know, talking to other CEOs across the system, everybody in the health systems that I know of lifted early on their incident commands to where we have what we call, our operations section chiefs reporting out, our medical director reporting out, logistics reporting out, all the way down to our safety officer and others staying up to date of what was going on. And that assessment early on is, if you all reflect back to those first days, we were looking around the nation and around the world with what was going on, a lot of fears. And early on, those fears were validated when you were seeing the deaths tied to that in other countries. And then as we started seeing that on coastlines, the big focus obviously in New York, what that looked like in New Jersey, health systems around the nation were looking to prepare differently. And I put a snapshot of just, as a reminder, early on, we were getting news reports that coronavirus could kill millions of Americans. Do the math. And without the vaccines, that was a real scare. It was something that everybody was preparing for. And as I mentioned, lifting up incident command, safety was first in everything we did and every decision we made, which you can imagine interacting with all of the CDC guidelines, state guidelines, even FDA guidelines, and all the elements of what we were doing operationally started with safety first. How can we take care of our staff and our patients and our providers? We made was related to what's it for our staff, what's it mean for our providers, what's it mean for the patients we're serving. PPE conservation, the two big things that you heard around the nation absolutely impacted us within Olathe Health on PPE conservation. Back now, and I remember when we first did an inventory assessment of, how many N95 masks do we have and on hand, and what's that look like? We had 200 masks. And to put it in perspective, you might go, wow, isn't that enough? Every patient that came in as a person under investigation for the COVID virus, if you had those symptoms, and there were a lot of patients that had the symptoms with their fever, looking down at what might have been a list that started with 4 or 5 indicators that just kept expanding to what were symptoms patients could have, every one of them, we would have to mask up. And we learned more about masks in healthcare than I think any executive team or incident command put together, as I talked to other systems, would ever want to know about masks. But buckets we ended up putting together, which were masks that we considered barrier masks and masks that we considered protection masks. So all our caregivers that needed to be protected caring for PUI patients were obviously given priority on the protection masks. We now, I can share with you, have plenty of supplies. I remember we had celebrated, we had over 1,000 N95 masks, and then we celebrated, we had really over 10,000 N95 masks. So that journey has changed over time, obviously. But I can tell you some additional stories on Ppe Comfort Conservation related to things we had to do differently and innovatively here in a minute. A lack of testing availability, and there was the early testing of what did we have? Do we have enough swabs? Do we have enough test kits? And then what did it look like sending it over to your lab so that you then had the ability to run those tests? And as my lab director put it when we were talking about, we had an inventory of equipment that could run the tests, but we just didn't have the reagent rentals and the things that, or the reagents to go onto those machines. She said, Stan, it's kind of like having a VCR equipment without the VCR tape. And we all laughed about that, kind of antiquated. And the phone, what a VCR tape is. Obviously, that's a few years back, but it's just a reference of we were really very vulnerable on being able to test. And mine, for every PUI patient we had in our health system as an inpatient, we were burning through our PPE from a mask perspective, and then our gowns perspective. Obviously, all the other elements. We had a list of probably 25 PPE indicators we looked at every single day in incident command. But when we're waiting on those test results to come back, we were burning through supplies. So it became very sensitive to every health system when we had to wait more than 12 hours, 24 hours, 48 hours, 72 hours for a test result to come back, burning through that very vulnerable or very sensitive amount of PPE supplies that we had. So as we would escalate up as CEOs and incident commanders in our team to the state and or the county to what you have available, you can imagine every health system was doing the same thing. So testing turns were things that became a top priority for us. Looking at outside organizations that could run tests for us, we found very quickly early on that one of the closest facilities was in California. So it was a 4-day turnaround. So we were balancing, okay, we have 72-hour turnarounds locally. If we send it outside the state, it's going to be a 4-day turnaround. And so one of the things that we really worked on, and it was a blessing for us, is that those reference labs actually, in a very quick way, launched new reference lab locations with equipment in Lenexa metropolitan area. That just kept expanding, and as that was expanding, our ability to get our test results back started getting into the 48, 24-hour time frames, and then under 24 hours. And that's very important as you looked at burning through our PPE that was vital to keep our staff safe, to keep our providers safe, and to keep our patients safe, obviously. And then moving to just a concept that may not have realized was going on behind the scenes, but as you look what was going on in New York, and then because they did have deaths, the other fear factors that there were individuals that were the funeral homes and those that normally would take bodies out of morgue saying, we're not going to accept them. So we also, through Incident Command, had to do a makeshift morgue with a trailer that had a cooler in it and all those type of things, preparing for the worst. And I only give that as an example of just the types of things that you'd go through in preparing for this pandemic that was going to early on hit us pretty drastically in the Midwest as well. And so shutting down the United States, I will absolutely tell you, and I know every healthcare CEO would agree, was paramount to our ability to catch up as a health system and health systems around the nation on our availability of PPE, preparing for what testing was going to be needed. The demand, because of those individuals that were positive, did slow down enough that we could catch up. Ventilators, another great, we were constantly innovating where we were running out of ventilator capacities when we modeled the types of projection of types of patients we're going to need, the percentage of those that would be admissions, percentage of those that would need ICU, the percentage of those that would need ventilators. We very quickly realized that we had a supply, but not necessarily the type that we would need to take care of, the volumes that we were looking at the mass amount of volume we were looking at. We even calculated, here's the number of ventilators we have in our ICUs. We also have a secondary group of ventilators from our ORs that our anesthesiologists use that we would say as a backup. What's saying if we used every element we have, now we have about 56 of them all in, but preferably we had about 15 for our ICUs. The unique thing is when we started looking at innovative ways, where can we get additional ventilators? Well, we were thinking, well, we had a call with a prominent veterinarian in the Olathe area, and as we were calling his animal hospital and his clinics, they were absolutely willing to give us their ventilators to assist us. And that's an example of the community outreach that we had, only to find out the government had already thought of that and they'd already swept all the ventilators needed for some of those hot spots around the nation. We also found that when you looked at the type of inventories that the government was looking at, every time we would go to look at buying and purchasing more inventories from different sources, the government was one step ahead of that. And the government was really appropriately saying, we've got to control all this and push it to places like New York first. And so then we had to look at secondary, tertiary, and then eventually there was 5 levels of avenues we were looking at for where we can get inventory of supplies and equipment. There were quarantine requirements. Unique for healthcare, everybody knows there's the 14-day quarantines that occurred when you were around somebody that was positive or you traveled from other places. But we learned very quickly that if we had any exposure of our staff next to other staff members, you could see the cascading impact that would have had of us quarantining our staff that then resulted in less caregivers for the future patients. I can confidently tell you, and with great outcomes, that we never had one of our staff members, because we did give them the proper protection, acquire COVID from a onset of something that happened within the health system. Planning for potential outbreaks among clinicians, that was something we also looked at. And then also focusing on the skilled nursing facilities, as well as what we looked at from our post-acute partners and what they did to lift up their organizations to keep their places quarantined and safe so that we could limit that exposure. Support for our associates. One thing we also did is recognize we have more and more of our staff needed on the front lines, and with schools closing early, they normally had coverage for their childcare in the summer, but they didn't have it at the time schools closed. And so we have on our campus, on the Olathe campus, the YMCA, and talked to them because they were also closing down, and the innovative things we did on partnership to create childcare for our workers was just another example of early days, things that we were trying to prepare for with the pandemic. Susie, if you go to the next slide, please. And then we look at really the reality of the situation. We prepared for the surges, continuous communication, management by the numbers to this point. We're managing to that. Numbers are looking very favorable. Early on, I'll tell you that the percentage of patients that were positive that we tested that were PUIs were about 13%. So every 13 out of every 100 that we were testing, 13 were positive. And then as each week went by and more denominator of patients being tested were out there, the number went to 11, went to 10, 9, 6%. Right now, we're sitting at about 4% of all those patients that we test are positive. That's a great thing that it was moving in the right direction. And that does include updated information over the last 2 weeks when the communities open back up. So as we're looking at those numbers, that's very favorable for where we're headed. We also look at statistics of the asymptomatic patients, so that as we've ramped back up and we've opened up our diagnostic testing, reopened our procedures that were elective, outpatient, and the next week we reopened outpatient and inpatient electives. All those patients get tested, asymptomatic patients, and that percentage of our asymptomatic patients that are getting tested is 0.4%. So when you look at that number, that's correlating to what we see in the county, because the numbers in the county are very similar when they did their asymptomatic testings. And then when you look at new research showing the vulnerability of asymptomatic patients transferring the virus to others, a very, very low percentage. And that's a very favorable thing for all of us to think about. Extreme concern about the lack of PPE, obviously aggressively buying through new channels. Another example of that is that with the government pulling all those other resources that we normally have as normal channels, we had to look at new channels. For example, we did start ordering through a contact we had, supplier in China, to come over. And when it came over, our supply chain executive said, Stan, I didn't know about getting in and being educated on importing products. And then when it arrived in, I think, Illinois and Chicago, when it came to us, it was all in Chinese. We had to actually interpret. We have 4 individuals on our, which we have as associates, that are competent in transcribing Chinese. And so we were able to tie that person with our safety officer to ensure that the mask did what they were supposed to do for safety. And the difference between barrier mask and protection mask, all of them across the United States, across the world, when you look at indicators that people use for protection, all of them are pretty much 95% or better on protection. Where you get the difference between those that are protected versus barrier is really the fluids that go in and out of a mask. And if you ever thought that a CEO would know that much information about a mask, you can smile a little bit and recognize that we all got into some of those details because it impacted our strategies of how we rolled out future thoughts of how we did things. Creative techniques to sanitize our N95s. Many health systems have the ultraviolet cleaning equipment so that you can really kill bugs at a higher rate. We were able to process and use N95 masks like 5 different turns by putting them through the ultraviolet cleaning process, which again gave us a runway as we were getting more and more supplies coming in. And then collaborations at the state level, we were on calls 2 or 3 times a week with the state, obviously the Secretary of Health. A lot of individuals across all health systems were doing that. At the county level, we had a task force put together, but we also worked very closely with our county health officials, not only from our system, but we collaborated very closely with the other health systems that are in Johnson County, also through Metro Kansas City area. The first week, I'd reached out to the other CEOs and said, we really need to kind of communicate better about what our plans are, what each other's doing, learn about each other's best practices. And that very next week, between Missouri Hospital Association and Kansas Hospital Association, the Metro KC health system CEOs were meeting twice a week to talk about each other's best practices. How do we make sure the tide rises for all of us at the same time? Obviously, the focus on safety. We learned very quickly that our chief medical officers needed to meet weekly, our chief human resource officers, our supply chain executives, and our nurse executives. And so there were these constant conversations about advancing communications. As Dennis mentioned, really you look at organizations that normally compete with one another. With this pandemic, everybody came together. It was really all hands on deck to ensure that we had the safest approach for the patients that we care for in all of our communities. Looking at the success and caring and treatment, I have a picture on that slide where we have an individual that was leaving our organization after being one of the most critically ill that we had at Olathe Health, where she came in. She was put on a ventilator in our ICU. She eventually was trached for the severity of her illness. By the way, from a HIPAA standpoint, she's okay with me talking about it. She also posted it on her social media. But we were able to, after 60 days, discharge her from the hospital, which is one of those things when you look at our caregivers, you can imagine the emotional drain they had for all the PPE they had to wear on PUI patients, being exposed. The good news is being exposed was more of a fear than reality because we did provide them all the PPE they needed, but just the mental anguish that you can imagine that they went through. So when you have these favorable and positive things going on, you really want to celebrate it to refuel the staff members. And then Susie, if I can ask for the next slide. And that tied really nicely into what we did with our community. And I can tell you the outpouring of value that we had from our community. The chamber in particular created the Frontline Fund, and support from the restaurants is a great process to where our local restaurants, we had organizations outside of that funded it, that actually got the restaurants involved to support or supply the food. Then that donation came to the healthcare workers. You can see in our main lobby in that top picture, if you have opportunity to see the slide deck, where food was wrapped around our front entrance where our caregivers could come downstairs and pick up a box of lunch. And the most important part of that is not only feeding them, but their knowledge that the community was behind them. And then looking at church groups and individuals that donated masks and face shields and food, and then people did the drive-throughs honking for our staff members, and we had signs on our campus of support. That did not go unnoticed. Actually, it was very important to our caregivers. We got thank you notes from kids that we actually put out on our daily update with our updates from our incident command. And talking to our caregivers when we were walking around the different areas, it meant a great deal. The school district early on said, Stan, with our schools closed, I know there's PPE issues. We've got hand sanitizers or anything we can do. That was vital for us early on, and then ongoing with food, and then innovative solutions on how we prepare. And then internally, our staff members said, you know what, from our food nutrition department, they created bags of healthy groceries for our caregivers that really, it was about $9 for a bag of groceries. And they said, you know, for donations, if we get enough, we can hand these out. And really internal to our organization, $5,000 were raised so that all of our staff members internally could take a bag of groceries away. So just those are examples of the community support and where we're headed. That said, I think I'm ready for the next slide, so I have some time for questions as well shortly thereafter. And where we go from here is innovation that makes us better. I think the thing that we learned, and now that it's, you know, kind of plateauing, and we've now gone through 3 other phases internally, ramping back up, our teams are reflecting at just the incredible amount of innovation that has occurred within our organization that's going to share or lift us up for the future. Telehealth, you see that across the United States, that where a lot of organizations felt, in us in particular, that we were about 8 months away from really expanding our telehealth capabilities. In 2 weeks, our IT support teams were able to launch out some telehealth at a new approach and avenue. And the reason we were able to do that in 2 weeks is the federal government. In healthcare, we have a lot of regulatory requirements between us and providers, and what we look at released some of those requirements. And the fact that they released so many of those things for us to work in an innovative way, you can see that without some of those things, we were able to do it within 2 weeks to get telehealth out there. And so when we were seeing about 500 patients in our clinics across our system a day during the COVID outbreak, about 100 of those were telehealth, telemedicine capabilities. And then as we ramp up, we're now seeing about 1,200 a day again, 1,500 a day. The nice thing is telehealth is still there ongoing. Spot Savers, we have that launched so that less time in the waiting room, so you can go online and kind of hold your spot for your clinic visits. And then aerosolizing procedures, what we do now for things that we had to, you know, health procedures. But with this pandemic, we actually raised a whole nother bar of a thought process that ongoing with which we've moved forward. Open and available for care, obviously safety first, but we had our phased re-entry for our procedures. We're in essence open for business. All the other health systems are too. The nice thing is, even when we talked about our re-entries and being an essential business, the state required for non-essential businesses, but no actively across Metro KC, because we were communicating weekly, all the health systems were within a week of one another doing that. And then continued monitoring, just looking at guidance daily was changing. It's probably, but it's all going to be data driven on where we're headed. Really, at that point, I share with you that we're open for questions that you may have, but I have to share with you, could not be more proud to serve as a CEO of Olathe Health, given just the amount of partnerships we had with our community members, partnerships with the chamber, partnerships with our providers, the collaboration and teamwork that we had within our system that many of you probably have faced in your businesses, where this is a time frame I know all of us a couple of years from now will look back and say, all of our associates that were involved in that together. You know, I always tell our teams that you take out sleep, you spend more time at work than you do your primary family. So work should be your secondary family. That was not, it won't be more evident than what we're going to have through this, of just the family feel we have now through Olathe Health by going through this pandemic together. Thank you.
Perfect. Thank you, Stan. We've got some questions, but I'm actually going to kick it over to our sponsor, Dennis. I know you have a question, so please go ahead.
I do. Stan, thank you for that overview. That's amazing. And so glad that you're there in this time of need. And it's amazing what you've been able to do in less than 2 years. Do have a question for you. How did this event compare to other emergencies you've had to deal with as a healthcare executive? And how has it changed how you will prepare in the future? Might be frozen. Lost them.
Oh, we may have lost her.
Why don't you answer that one, Tim?
Yeah.
Here he comes.
There we go.
All right. Here, let's get you
What's up, Brian?
unmuted.
Yeah,
Can you hear me now?
I can.
All right, I'll repeat the question real quick. How did this event compare to other emergencies you've had to deal with as a healthcare executive? And how has it changed the way you will prepare in the future?
Great question. I had the privilege to serve as a chief operating officer on the East Coast of Florida under a health system I was with prior, where we were hit by 2 hurricanes within a 2-week period. So one hurricane hit, and as we were recovering from that, a second hurricane hit. And so with some of that experience, and I also went through some tornado readiness when I was a CEO in Oklahoma. But how it compares, what was really unique is that you set up your incident command. Every situation is different. You're assigning your individuals by your different section chiefs. And the difference for me is that sometimes those activities happen for 3 days, 5 days, maybe 1 week. The fact that we've been doing this as long as we have really related to different endurance of how we approach incident command. For example, you have a labor pool that goes up with incident command, and all your team members that are available go to a labor pool. That's great where you get to allocate them as resources for 3 days, 5 days, 7 days. But when you look at this type of time frame, we had to look at a whole different process for how we created really a department tied to screeners at doors, and how we had to assign individuals for that. And then now as we're transitioning, those screeners will still be available at the doors, but we're actually creating greeters out of the screeners. But that transformation is just one example of how we do things differently for today, and it's going to continually evolve. But I think the wonderful thing that I saw is every prior incident I've ever been in, when you debrief, usually the number one concern and issue is communication. It usually comes back to, we could have communicated better on X, Y, Z. What we've heard throughout our updates is that, and as I ran it and talked to teams, they feel like they're getting enough information. This one was unique in that we were sending out daily updates to all of our associates and all of our providers. We also had daily calls with our team members, and we had our medical executive committee of our physician leaders that we were on calls with every single day as well. So everybody knew, as all these changes were occurring so quickly with new information that's coming out with this pandemic, that it really allowed us the opportunity to over communicate in my mind. But as I talked to the team members, they're like, no, that actually worked out very well. And then for lessons learned in the future, I actually shared with the team related to incident command. We are now more prepared than ever on how to deal with future pandemics and or future instances that occur that are non-pandemic. The amount of collaboration that we now have with all the health systems and the county and the state will never go away. I think that there is a new level of collaboration amongst all of those organizations and departments and facilities that we know we'll have for years to come.
Wonderful. Thank you, Stan. Okay, we've got a couple other questions here. So you represented the hospital system on the Johnson County Task Force that determined the timing of the county's stay-at-home order. Do you believe that stay-at-home order helped minimize the number of COVID-19 cases, which I think you said you believed it did? And are you comfortable with it being lifted at this time?
We absolutely believe that, when we were looking at the governor's activities, and I want to start with her before we go to the county. She pulled together, well before she made her announcements, about 12 healthcare CEOs around the state. I had the opportunity to talk with her about that. And her big question was, when we do these rollouts, one of the biggest things that they wanted to do, and the county wanted to do the same thing, is ensure that our healthcare organizations could handle any mini outbreaks or new outbreaks. And did we feel like we now had the inventories of PPE and equipment and staffing and supplies to manage whatever was going to come out in the cascade of the phasing? Unanimously, all of those CEOs around Kansas agreed that we were ready. That allowed her to go in and say, okay, what is it that we're going to say we need to launch with? And then what were the indicators? And one of the things that I had the opportunity to share with her is we don't need to look at just individual cases of COVID, because they will go up. As you look at, even though it's only 4% of those we tested and 0.4% of those that are asymptomatic, the quantity of those that are positive just keep going up. Not uncommon. That's just an epidemiological thing that happens. The more important thing is, what's your rate per 100,000? What's your number of hospital admissions? And then what's your death rate? And that was what was nice, is they really put some great indicators that said, if the trend lines are showing that those indicators are either stable or declining, those allow everybody to kind of open up more of what we're doing. Right now, I think the phase of what we're doing and continuously opening up is adequate. I do believe that while we have blips and outbreaks occurring, that the trend lines still show that it's favorable in Johnson County. And I will say that the lowest common denominator everybody should use really does come back to county-specific information. When I also said I yield the counties on certain items that she did, that was appropriate, because some counties might have outbreaks that actually change their trajectory and their trend lines on the important indicators. They should look at things differently than those counties that are actually trending the right way. Now, yes, you have individuals that can cross over counties and they go visit different counties, but relatively speaking, I think it's appropriate timing of how we're advancing. Did I give you a good enough answer on at least some more data points to think about when we're moving in that direction?
Absolutely. No, thank you. All right. Our next question is about testing. So they've heard that testing, there's been shortages. They've heard conflicting reports on that. What is your thought? Is that an issue in the KC metro area? Are we good on tests, or go ahead?
I will tell you that, once we were talking early about the test kits to test for COVID, and then somewhere in the middle, we started talking about the antibody testing. And so if I could also, for your viewers, make sure we split those two things apart. When it relates to the kits for COVID testing, there still are in pockets through communities challenges getting the test kits. In the metro area, most, if not all of your metro health systems are getting the kits. The challenge is those kits tied to reagents that then tie to how you process them on the equipment to get the results. And so the reagents for certain types of equipment is sitting there because you don't have enough of those. But I will tell you, with the improvements made by reference labs and some resources, we feel comfortable that we're getting all the tests we need in Olathe Health. And then talking to other health systems, as remember, we're testing more asymptomatic people too. So the exponential number of tests being performed, because when we do procedures now, we are testing individuals, and other health systems are doing the same. The quantity of tests are increasing. And really, as the CEO speak, the number of concerns related to test equipment from that standpoint has diminished significantly. So I think that we're starting to get the supplies that we're needing from that standpoint, from a health system perspective. When it relates to the antibody testing, while there are a lot of claims that that's available now, there's some organizations saying they can't do it. From the healthcare side of things, just know the culture in healthcare is you've got to have a lot of research behind that. You've got to make sure that you've tested all the different ways to ensure that it's really doing what it's supposed to do. And so you may also hear from the healthcare organizations that they're cautiously saying that if you see an antibody test out there, it may not really be ready yet. And then you see on the news, some are ready. And then you hear from nationally that it'll probably be ready by 2021. There's a lot of confusing information out there about it, but I'll share with you from our network of providers, we're holding off on the confidence level of antibody testing at this time.
Perfect. Well, this actually leads into the next question. The next question is about vaccines. There have been a number of recent articles regarding the ability of pharmaceutical companies delivering a successful vaccine by as early as the end of the year. Given how long vaccines normally take to develop and bring to market, what is your sense of the ability to meet this aggressive timeline for the COVID-19 vaccine? Is that?
I will preface all of my answers that I am humbly a CEO and I'm getting my information from others as well. But my impression is that it's an unprecedented time for all of us on the pressure from the government, releasing barriers that others might have had to go get the vaccines going. The sandwich of that being that there are suppliers of vaccines that are racing at exponential speed than they've ever done before to get them. So the normal timeframes that we look at for vaccines, I confidently will tell you that it's going to be faster than normal, but probably not as fast as everybody wants it, because you still have to do all those validations and making sure that you're doing it the right way from the scientific, research-driven way that you develop vaccines. So there's a sandwiching that goes on between, there's barriers opening up from the government saying, go get it quickly, and then those that supply vaccines saying, I've got all hands on deck to create it. So it will be a shorter time frame than we normally see. How much is just dependent on the fact of the speed that we're going to have to hit certain milestones to do it right.
Absolutely. Thank you. All right. The next question has to do with, obviously there's going to be increased social interactions with summer coming up. And of course, some of the stay-at-home orders also minimizing. How would you recommend, what's the best way moving forward that you can minimize having a second surge of the pandemic?
Hand sanitize, hand sanitize, hand sanitize. Make sure that you're cleaning your surfaces. The 6 foot distance is absolutely appropriate where possible. Where you can't do it for more than 10 minutes, wear a mask, wear some barrier protection. Those 3 big buckets of barrier protection, hand sanitizing, and cleaning your surfaces are probably the big 3 in everything you do. Now, that said, you see pictures of people at beaches and partying in places where it's crowded. Obviously, all the riots. Clearly, on the healthcare side of the riots, looking at that plus the protesters and the protesting crowds, all of us are very sensitive to how close those individuals are. Now we're kind of all looking at that 14-day window with all the protests around the United States and the close proximity of these individuals. We're all watching. And what we're watching for is, for every 100 protesters, you look at the statistics we just gave, you know, at 4.4%, or let's say 1 out of every 200 protesters is asymptomatic positive. Who knows how many people said, I'm not going to miss this opportunity to share my voice and my free speech, even though I may have a fever, that was symptomatic walking around in those crowds. And so those factors, you know, we're all very sensitive to in healthcare, watching for the next 14 days, what's that look like on those individuals impacting our health and healthcare systems, as an example. So as far as example, what do you recommend? Those key 3. You can't sanitize enough on hand washing and keeping your distance where you can. And then for businesses, make it very noticeable for how you're cleaning your surfaces. And I was talking to leader of a restaurant recently, and I said, you know, one of the key things, and this is probably a key point too, if I can just make a little personal note, a lot of places use gloves. They're like, we want to show our patrons that we have gloves on. Our infectious disease individuals say sometimes gloves are the worst thing you can do, only because people get a confidence level that is not warranted, meaning that they get confident, I'm wearing gloves, so I start touching all kinds of things, not realizing how quickly and how frequently you're supposed to don and doff your gloves for appropriate gloving. And we found that if you're not gloving, individuals are actually more inclined to sanitize their hands more frequently. So for businesses listening, if you're thinking gloves are a good thing, they are if done appropriately. But I will tell you that from our standpoint, it's actually easier to make sure you have hand sanitizers out, and then do like we do in healthcare. Before we go into patients' rooms, we have all those sanitizers at the walls for a reason. We do it so we can walk in front of the patient and they can actually see us sanitizing our hands in front of them, because they have no idea what we did outside of that room. Same principle should apply for businesses, saying, don't do that off stage, do that on stage. Make sure when you're going up in front of your customers that they see and notice that you're doing those type of things. They see and notice that you're wiping down surfaces.
That's wonderful advice. Thank you, Stan. So of course, COVID-19 is the highlight right now, but you guys are so much more. I had someone reach out and say it was exciting to see how many Olathe Health providers being active on digital and social media, helping provide information and answers to questions and concerns of the community. Can you talk a little bit about your commitment to being a trusted source for answers and information to the community during this time and all times?
You know, I had the privilege to become the CEO of Olathe Health in November of 2018. And I knew when I interviewed, I walked into an environment that was a trusted health system where the community's already trusted this organization. The fact that we were networked with so many clinics in 5 different counties. We have our 2 hospitals within Olathe and Miami County. The culture was set that safety was first and that we were here for our communities. And what was nice is as we've created our Olathe Health Physician Network and our independent providers that partner with us at Olathe Health, there's also a synergy that this is their home, their family. And walking into that just was a blessing for me. Of course, my role is to keep advancing it, but be assured that your caregivers are putting you first. We've had incredible conversations with them. Our chief medical officer during COVID had calls every night in the beginning with our providers where we had over 150 of our providers on their own time getting on that call just to keep up with what was going on. And then we also went to every other day. Now we're doing it about once a week. But your providers always wanted to know what's the latest. There was question and answer. How can we make sure we take care of our patients safely? How can we make sure we and our associates around us are safe? All of the things you would normally see that fears were out in the community. Even providers, because of the unknowns, needed to rally together because of those fears, and felt very confident that we were all doing this the right way. They also talked to their peers in other health systems to say, how are you doing it? We got a lot of feedback and instant command from providers saying, I'm checking on these things. How do we do it? Can we look at this way to innovate for the future? And when I mentioned like the tide is rising for everybody, the great news is the collaboration, the family environment we have at Olathe Health is strong and stronger than ever with our providers, and they can trust their healthcare providers to be there. You know, there's the business side, if I'll say that for a second, of healthcare, where when we launched telemedicine through this pandemic, the provider said from their perspective, I want to make sure our patients are taken care of. We'll deal with the business side afterwards. We took care of the business side of things. But it also gives you the thought that they're there for the patients first. And our mission is, it goes back to our mission, and we live it every day. And I tell our teams that, you know, whenever you step on any of our campuses, you should embrace the fact of why we're here, our purpose, and it's to help people through healing, health, and happiness.
Wonderful. Well, kind of playing into that question. So with the pandemic happening, you guys had to jump into things pretty quickly. Is there anything that you learned from this pandemic that you're going to carry going forward? It may not even have to do with the pandemic. It may be your communication, maybe the weekly. I mean, is there something that you're going to continue forward with?
There's a lot of things. I'm sitting there thinking, looking at your time. There are absolutely nuggets that we took out of instant command. There's nuggets that we took out of processes. It's amazing when everything else goes to the wayside. And, you know, we always talk about in business and processes and caring for patients that you're always juggling about 8 balls at the same time. When everybody's focus was on the pandemic and our response to the pandemic, just as we were shutting down certain services to respond to it, you imagine all the other priorities we were working on also took a back seat. And so we had the opportunity in a very short time frame to exponentially make improvements in workflow, processes, and communication, and how these individuals in different departments are collaborating at a different level that will never go away. So absolutely, we're going to be performing at a different level ongoing with daily operations. And then the nugget also that's out there is that as we were going through the instant command issues, I reminded our teams, please make sure we don't lose that for future incidents that have to come up through command center. And we now have a portfolio of things that we can really just take that playbook, pull it out no matter what the incident might be through instant command for the future. So I would say that as I look at it in swim lanes from daily operations, connectivity between our 2 hospitals, connectivity to our clinics, what we do through our supply chain operations, all the things we do to communicate outside our organization, the speed for which we now have those connections with people at the city, the county, and the state level, and all those other networks of our CNOs now knowing each other in the hospitals, the CFOs, the HR executives, the supply chain executives, clearly the CEOs, will be at a level that is unprecedented, without a question.
Perfect. Thank you, Stan. You are such a great partner. We have one more question for you, and then we're going to wrap it up. And I do know that we didn't get to all the questions. But last one, is there anything that you would like to tell us about your campus going forward? Any plans that you would like to unveil right now?
Well, what's interesting is, as many businesses on the phone call, strategy doesn't stop with this. The operations had some things that were probably postponed for future months. But we have a lot of exciting things going to be happening with Olathe Health. Obviously, as Dennis mentioned earlier, we've got projects going on right now for growth. We have other things through our communities we're serving that relate to growth. Here recently, Children's Mercy, that CEO, Paul, and I started actually on the same day, back in November of 2018, and he and I have developed a great relationship. Children's Mercy is now on site with Olathe Health, caring for our NICU babies. From that standpoint, we're talking to them about other service offerings as we really want to make sure we look at potential partners we're talking with to look at how do we make sure that we are expanding services we currently don't do on our campuses so that patients can stay close to home. At the end of the day, every health system wants to make sure that their patients stay close to home, and couldn't be more proud of our teams for where we're headed from strategy and operations recovering from this.
Well, Stan, thank you very, very much. I think we could have asked questions all day long, and I apologize to everyone that asked a question that we couldn't get to them. But Stan, once again, thank you, and thank you for everything you do in our community. Thank you for serving on our board as well. And I'd like to thank Dennis Burns with Pulse Design Group. Dennis, thank you for your sponsorship, and thank you for your participation in the Olathe Chamber as well, too. So. Everyone, thank you for being here, and thank you for listening in on today's call. And with that, I think we shall adjourn. Thank you, and have a wonderful day. Thanks.
My privilege. Thanks.
Bye.